everyone. I'm Adam Brown, and this is ShellPoint Today for Tuesday, June 16th. On today's show, we will discuss dental implants, and we'll kick off a three-part series on dementia care, hosted by Dr. Hirchak and his special guest, Dr. Schaerf. But first, we want to remind you that tomorrow you are invited to an investment roundtable discussion held by Finemark Bank. This open forum will be hosted by investment experts at 10 a.m. in the Manatee Room on the island. Seating is limited, so please RSVP to Anna Smith at 461-5930. Also tomorrow, you can find out more about the technical support services here at ShellPoint and how they help with your television, computer, iPad, smartphone, and more. You'll meet the technical staff that coordinates these services and learn of some of the challenges that they have met over the years, what their areas of focus are, and their hopes for the future concerning technologies and communications here at ShellPoint. The presentation begins at 1:15 in the Social Center on the island, so don't miss it. We all know how important our teeth are, not only for the functions they perform, but also for the beautiful smiles that we all like to have. So, what is the solution for losing teeth due to periodontal disease, injury, or just some other reason? Well, this is where dental implants come to the rescue. To find out more about the types of implants available, how they work, and whether or not they might be right for you, Dr. Douglas Milsap discusses a presentation that he will hold this Friday that you can attend. Here's Heather Batty with more.
Hi, I'm Heather Batty with Resort Services, and today I'm here with a special guest. He's one of our dentists, Dr. Milsap. He's going to be presenting a program for the Health Connections on Friday, June 19th, called Dental Implants. What, how, why, and why not? So that sounds like a very interesting program.
It is. I'm looking forward to giving it.
Can you tell me a little bit more about what will you really be discussing at this?
Well, people are in general knowledgeable that there are implants, but as far as the nuts and bolts of how it works and when it doesn't, and who's a candidate for it and who isn't a candidate for it, oftentimes they're not very well educated in it. And so if I can explain it so in kitchen table terms so that it's really understandable, that's my goal. Right.
Now, how often is your service available here for the residents?
Well, I've been the dentist at ShellPoint for a little over 27 years now, wow. So I've been here a while. I'm up here myself every Wednesday from 8 to 5. We have a hygienist with us every day. My associate, Dr. Streeter, is here on Tuesdays, and she has a hygienist with her as well. So we get full coverage, do pretty much everything we do in our main office here.
Oh, wow. So 27 years.
27 years.
That's a lot of teeth.
And a lot of patients that I've really come to know and love.
That's wonderful. What are some of the implants that you'll be talking about?
I'm not planning to pretty much go into brands of one versus the other. Okay. There are some advantages to some. Each company has things that they have advantages of. So when we offer implants to our patients, we use various brands depending on the individual need of the patient. Right. So I'm not so much interested in, whether we're talking about Coke or Pepsi as to whether, what's the best way to have one done, what are your needs, what are the expectations as far as discomfort or no discomfort, sure. How long do they last, that kind of thing.
Right. I think that's a good question is, getting answered how long do they last. That would definitely be one of the questions I think you might get asked.
Come see us and I'll enjoy enlightening you.
Perfect. Well, it sounds like a really great program. And again, it's dental implants on Friday, June 19th at 10:15 in the Social Center. So we hope to see you there. Thanks and make it a great day.
One of the vital keys to overall health is having a healthy mind. Declining mental health is a serious issue that concerns all of us as we age and can affect our quality of life and impact our family as well. The most prevalent type of cognitive decline, or dementia, is Alzheimer's. ShellPoint's Vice President of Medical Services, Dr. Roger Hirchak, recently sat down with psychiatrist Fred Schaerf, who specializes in these diseases and has conducted some remarkable research and studies on dementia care. Together, they discussed some of these studies and the impact and treatments that are lately being pursued. Today, we bring you the first part of this interview that we will be showing over the next 3 days.
Welcome. I'm Dr. Roger Hirchak, Vice President of Medical Services for Shell Point. I have the opportunity today to meet with Dr. Fred Schaerf, who I believe is a renowned psychiatrist in this area with some remarkable studies with dementia care. And Dr. Schaerf, thank you for being with us today and giving us some of your time.
And thank you so much for having me.
Believe me, it is really our pleasure. Dr. Schaerf, if you would just, for our audience, talk a little bit about your past history, your schooling, and your drive to become a psychiatrist, and why.
Well, I mean, I've had an incredible journey, and that journey probably started after 4 years at Virginia Commonwealth University, where I was pre-med, and then I took a little bit of a different course and was able to obtain a PhD in reproductive endocrinology, followed by my medical degree at the University of Maryland. And then things became very fortunate for me, where I was accepted at the Hawkins Hospital and did a 4-year residency in psychiatry with some medicine and neurology involved, and then was able to actually stay there as an assistant professor for 2 years before coming to Southwest Florida, seeing this as a real destination where there's great opportunity for the type of psychiatry I was taught at Hawkins. I was with some of the leaders in Alzheimer's disease and dementia, like Marshall Folstein and Paul McHugh.
Great. And Johns Hopkins, as everyone knows, is a supreme facility. And Fred, you have a number of certifications. Could you tell me about your board certifications?
Well, I'm board certified in adult and general psychiatry, forensic psychiatry, and I was board certified in geriatric psychiatry, but I did not renew it because we're really focusing on this really exciting time where the research efforts are really what's pushing our whole office.
Yeah. And Fred, it's fascinating to me how society in general right now and medicine in general is realizing how important the mind is as far as the overall health, and how neglected the behavioral health aspect of the treatment of individuals is, underfunding and so on. Tell me a little bit about, from your perspective as a board-certified psychiatrist, what is the impact of dementia throughout the United States, just throughout the United States?
Well, I mean, we're in a really interesting time that way. And, you know, the one thing that I'm always asked is, what's the difference between dementia and Alzheimer's disease? And dementia is just the broad category of a cognitive decline over time. Similar to if somebody said, I have cancer, it doesn't tell you what type. So there's about 20 or 30 different types of dementia. But Alzheimer's disease is the one that is really most prevalent. And as of today, there's 5.5 million Americans with it, probably 45,000 in Southwest Florida. Age is a terrible risk factor. So if you're 65, 10% of people have it. If you're 85, 50%. It starts 20 years before you have a symptom. And people say, why is there such an Alzheimer's epidemic, and why are we looking at that? And it's because medical science has really taken on and put to bed, in a way, all the other diseases that used to sort of get us. So heart disease, mortality is down, cancer, diabetes, all these things are really down, which leaves our brain back to where we are in these bodies that are growing older, and then it gets diseased for many reasons, and that's what we're left with. So if you're 65 years old, you'll live another 20 years because you fought back all the other things that used to get people. And you know, our lifespan has increased. In 1900, the average person lived to be 52. So now it's up to the 80s if you're a female, and close to the 80s if you're a male.
And this is something that we all face as we walk the journey of life. And this is, I think, something that we are all concerned with. Will you lose our cognitive ability to be able to process, to have quality life? Because without our mind, we have no quality of life. And there certainly is an impact on our spouses, you know, also.
Well, it is, and it's also a dirty trick because, most of us have learned that if we work hard and we retire, then we should have some wonderful years. And then when your brain starts having memory problems, you can't enjoy your grandchildren or love your wife or go on a trip and enjoy it. So it's a real issue. And, the other thing we're asked a lot is, what's the difference between, aren't you supposed to get memory loss as you age? Isn't that a normal part of aging? And the answer is there is an age-associated memory loss where people will forget things. For example, if you give somebody 12 words to repeat and remember, when we're young, we can repeat about 12 of them. And as we age, it'll go down. But even in our 80s, normally we should remember 4, 5, or 6 of them. So that's the normal age-associated memory loss. But we're talking about something different where you no longer have the ability to remember your doctor's appointments. You forget your keys. You get your finances confused. You start having word-finding problems where you can't remember certain words and you're stalling. And that's a brain disorder that we are taking very seriously. And the world sort of changed over the last month or two, which is also very encouraging.
Be sure to watch again tomorrow as we will continue with more of this important interview on the behavioral health issue of Alzheimer's disease. And now it's time for all the latest happenings, Academy news, menus, and Village Church connections.
Welcome everybody to the happening segment of Shell Point TV. I'm Bev Chandley and this is Caitlin Van Scoy, and we're going to go over the activities that we offer for you here today at Shell Point. We're going to start bright and early at 7:15 with a Health Connections class, Bend, Breathe, and Balance. That's in the Health Club on the island. We have 8 o'clock pickleball at the pickleball courts. Now the round robin doubles tennis will be down at the Woodlands also at 8 o'clock. At 8:15, the Stamp Ministry will be in the Stamp Room down in the tunnel. The Ladies Golf Association will be at the Shell Point Golf Club at 8:30. Moving on, we have a 9:15 caregiver support group therapy session in the conference room at the Medical Center. At 9:15, the memory care group will be in the conference room of behavioral health. Open painting will be down in the art studio in the tunnel at 9:15. And then we have a 9:15 shuffleboard game going on at our shuffleboard courts. Match play, mixed doubles tennis will be at the Woodlands Tennis Courts at 9:30. At 10 o'clock, Susie Q Boat heads to Woody's Waterfront Restaurant. That's in Pine Island, and sign up is required for those trips. At 10:15, Through the Bible study group will be in the Osprey Room. We have a caregiver support group therapy at 10:30. That's held in the conference room of the Medical Center. At 10:30, we have memory care in the conference room of behavioral health. We have a Life Quest to Living Healthy session at 11:45, and that's in the Osprey Room in the Resident Activity Center. Now here's Caitlin to tell you what's going on this afternoon.
Well, thanks, Bev. At 12:30, we have mixed progressive bridge being played in the game room of the Woodlands. And the Knitters group will be in the Osprey Room at 1:15. Also at 1:15, the Rollicking Recorderist will be down in the Island Tunnel. That's in the Tarpon Room. Also at 1:15, we have Women's Ministries Prayer Group meeting in the Hospitality Room of the Village Church. 1:30, we have a Health Connections class, Aqua Pilates Stretch. That'll be at the Life Quest Aquatic Center. At 1:30, we have a special presentation from John Gordon, Let's Talk Twins Baseball. That'll be in the Grand Cypress Room. Also at 1:30, we have the Stamp Ministry meeting in the Sable Room of the Woodlands. Balance and Mobility Training Level 2, a Health Connections class, will be held in the Health Club at 2:45. And at 3:15, the Celebration Ringers Rehearsal will be in the Choir Room of the Village Church. Well, that's all we have for you today. We'll see you right back here tomorrow.
Hello, I'm Terry Kolath with your Academy information for Tuesday. At 10 o'clock, we have the Fourth Crusade, Venice versus Constantinople, in the Grand Cypress Room of the Woodlands, and you can sign up right at the door. At 10:15, we have our eye clinic for questions on your Apple iPad or iPhone. You can walk right into the Manatee Room, and Penny Modridge of Nautilus will be there to help you. Tomorrow, we have 2 new classes. One is Coffee with the Neighbor, Florida Bird Safari with Dr. Gerald Langberg of Sundial, and we also have a technology class, Behind the Scenes with Shell Point Technology, featuring the staff of Technical Support Services.
Menus for Tuesday. In the Crystal Room, the Crystal Platter is beef stroganoff with egg noodles and broccoli. The soup of the day is loaded potato. In the Island Cafe for lunch, the special is a chicken quesadilla with fresh fruit for $7.75. The dinner special is your choice of a hot dog or a burger with a side salad, watermelon, and ice cream for $8.75. Dinner specials in the Palm Grill are shrimp scampi for $15.95 or a grilled pork chop for $15.95. All menus are available 24 hours a day at www.shellpoint.net.
Hi, welcome to Village Church Connections. I'm Andy Hawkins, the senior pastor of the Village Church, and I'm here to talk about the experience that my wife and I, Jean, had when we went to the General Council of the Christian and Missionary Alliance. Now, the Christian and Missionary Alliance is the denomination with which the Village Church is associated, and also the denomination that owns the Shell Point retirement community. And you need to be aware that certainly that's a significant denomination that has not only ministries here in the United States, but probably 9 or 10 times the number of ministries overseas. We have lots of people in more than 80 countries, lots of churches in more than 80 countries, in addition to more than 200 churches here in the United States. Well, once every 2 years, the representatives of those churches in the United States get together in what's called General Council. And it varies from place to place around the country. Last year it was in Tampa, Florida, and this year it was in Long Beach, California. So from coast to coast we move from time to time. And so this year in Long Beach, that's sitting across the harbor from the wonderful exhibit of the Queen Mary. And my wife and I had the opportunity to tour that ship, have lunch there when we had a little bit of downtime from General Council. So it's an interesting place to visit, but of course we were there for business more than we were for pleasure. And so the General Council of the Christian and Missionary Alliance is the opportunity for this denomination to really conduct the business affairs that concern various aspects of our life and ministry that affects not only the things that we do here in the United States, but also affects things that we do worldwide, because it certainly is a denomination that has a very strong international ministries focus. In any event, I'm going to talk today about the business part of this particular council, and then we'll talk a little bit more about the ministry part of council on our next occasion together. You need to understand that the way the Christian and Missionary Alliance works is much like many other denominations, that once every year or two, denominations gather representatives from churches, and they gather for the purpose of conducting business. Reports are provided by the President's office and his relevant vice presidents. They are distributed to committees who examine them and then bring back to the council floor various proposals for action by council, which becomes usually legislative action that governs various aspects of the life and ministry of the church. I've had the opportunity and privilege of working in the business area, and then you need to realize that not everybody loves business sessions, and a lot of the council delegates probably sleep through them, but then again, it is an important obligation for those who are representatives to engage in the things that really will affect the ministry of local churches. And it's been my privilege to participate in the business sessions as one of the secretaries of General Council. Myself and a couple of other people really take the minutes and make sure that we track business and know what motions are on the floor, which have been seconded, which are ready to vote, those kinds of things. And so it's been a delight to be able to serve in that capacity and not just sit in the audience or participate in debate or whatever other people do during those business sessions. Those business sessions are run, as you might imagine, decently and in order, according to Robert's Rules of Order. In fact, the person that has been moderator of our General Council of the last number of years has been a good friend of mine and a former colleague in Morgantown, West Virginia, a man by the name of David Gooden, who before he was trained as a pastor was trained as a lawyer, and so he was well suited to be able to conduct those affairs, and is one of the most gifted people I know in conducting business according to those kinds of rules. But I think think the most significant part about the way business was conducted is that even on those occasions in which there were some significant degrees of debate on issues and a lot of differences of opinion, in terms of how people engaged in that kind of debate and conversation was, I think, wonderfully impressive. Certainly the love of the Lord pervaded even those very controversial sometimes opportunities for debate, and people spoke with a great deal of respect and admiration for those with whom they might have disagreed about things. And that has been characteristic of the people that have conducted business in General Counsel in my experience, and I've been going to these meetings for more than 20 years. So that was an encouraging element of the kinds of meetings that are conducted. Now, in terms of actual business that was conducted, it's interesting every couple of years, since this is an every 2-year kind of council, we don't have lots of business to do, but we do some significant things. There was a Theological Studies Committee set to examine what's included in our Statement of Faith, particularly 1 or 2 articles of our Statement of Faith, to see if those things needed to be changed. And while there was some debate on those issues, they essentially followed the recommendation of that Theological Studies Committee, Council did as a matter of fact, to sustain the current Statement of Faith in its present form. We certainly recognize that that's a statement that is instructional in nature, and those who take our membership class, for instance, in the Village Church are acquainted very well with that Statement of Faith. It's not the things that everybody has to believe entirely, but certainly it's the things that are emphasized by the Christian and Missionary Alliance as an historic Orthodox Christian church. In addition to that, the Christian and Missionary Alliance updated its statement on the sanctity of life. Now, we've had a statement on the issue of abortion for quite some number of years, but as times change and as technologies change and as ethics change in our culture, it's important that we always revisit those kinds of issues. And particularly that statement needed to be revised in light of new technology that has been available for us to understand the nature of pregnancy, and as well the technologies that are being brought to bear at the end of life with respect to issues like euthanasia. And so a statement that had been crafted was presented to Council and affirmed by General Counsel as a policy that we have supporting life in its forms both at the beginning and end of life with respect to both abortion and euthanasia. The General Counsel also affirmed a number of opportunities to engage in partnerships with other organizations that have similar values than we have. Both here in the United States and across the nations as we engage in international ministries together. And I think that was an encouraging development as we seek to have cooperation among different groups that are inclusive of the body of Christ worldwide. And then there also were some actions taken on the nominating process and the election processes for those that come before General Counsel every couple of years. For instance, one of the things that was determined was it is now going to be possible, after this is ratified in the next council, to have proxy voting for our president when we elect a president of the Christian and Missionary Alliance. And the reason for that is that there are a number of people, particularly international workers, who are on the field and are never able to return to the United States for General Counsel, and as a result never have the opportunity to participate in the voting process for our most significant leader of our denomination. And so that will be possible in the next opportunity for elections when they come around, and I think that's a very great encouragement to those who are international workers. There are other ways that the nominating process has been streamlined to make elections more efficient and effective. And elections, of course, were conducted for a number of offices, particularly board of directors. The corporate vice president and corporate secretary were elected, also members of the Theological Studies Committee, a couple of other committees as well. And it was my privilege as one of the secretaries to conduct those elections that were taking place, the balloting that was involved there during one of those those business sessions. So all in all, it was a productive business session. It's not the kind of thing that everybody likes to sit through and listen to, but it's important for all of us to understand that the business of our denomination is done properly and in order, with a great deal of deference to other people and their opinions and viewpoints, but at the same time able to make decisions which will be fruitful for our denomination here locally and all across the globe in terms of international ministries. Thanks for listening to Village Church Connections, and we hope that you'll see the effect of the council administrations on the life and ministry here in the Village Church and in the Shell Point retirement community. Good day and God bless.
Thanks for joining us today. Be sure to watch again tomorrow, as we'll have more from the interview on behavioral health and the subject of Alzheimer's with Drs. Hirchak and Schaerf. Also, Melody Desolé will tell us about an upcoming tour of the Community Thrift Store, where you can learn more about what they offer and the volunteer positions that are available there. Until then, I'm Adam Brown for Shell Point Today, and it's Tuesday, June 19th. Until tomorrow, we hope you have a wonderful rest of your day.